Health talks. Organising health talks can be the easiest aspect to this campaign. Planning early and contacting the right person in charge will make life a lot easier in the long run. We would recommend aiming for 1 talk per week. That's a total of 4 talks during the campaign. Try to maximise the timing of the talk by organising them either 5 or 10 minutes either side of Maghrib or Iftar. Generally, weekends attract the most number of attendees, but you may have to tailor the dates according to your speaker's availability. You may want to deliver talks that are more gender specific or appropriate, or if your centre doesn't allow female speakers to address the male attendees, you could book additional single gender slots, or conversely aim to have a speaker address the male section and one addressing the female section at the same time. If you haven't already done so, find the best person to give you the necessary permissions to book your slots. We would suggest picking up the phone or arranging a meeting with them face to face, as this is much more effective than an email and a lot quicker than waiting for them to reply. Contact them as soon as you've decided on the dates and times to provisionally book the slots. We would suggest sending a warning shot to keep things as open as possible by explaining that you may need to change the date if a speaker is unavailable, but that you would contact them as soon as you can if that is the case. This will reduce the shock if you do contact them to change any future dates. When choosing topics, try and keep it as balanced as possible between clinical and non-clinical talks, and tailor it to the needs of your community. Some examples of chronic illnesses to cover include dementia, depression or diabetes, acute illnesses such as heart attack, stroke or asthma attacks, gender-specific issues such as prostate cancer, breastfeeding or menopause, and topics that are often less well recognized such as being a carer, pressure sores, or even hijama and cupping. If you'd like some ideas, contact your supervisor. You may be aware of several people who can deliver the talks, so try to contact them first, but if they do not respond within a few days, don't wait around. Ask your centre to suggest other health professionals, speak to work colleagues, your local council, or even health charities and organisations for speakers to deliver the talks. The speakers do not have to be Muslim or specifically a doctor. Bring in a variety of speakers. One thing to note is the possibility that your speaker may not feel comfortable or confident with certain topics. Without your speakers, you won't have any talks, so be as flexible as you can and ask the speaker if they have any topics they would like to talk about. They are more likely to deliver the talks more passionately if they are interested in that topic. Talks should be no longer than 5 or 10 minutes at most. Remember, everyone will have been fasting, and their attention span will be no longer than a few minutes. Ideally, the speaker should only mention 3 take-home points that are repeated throughout the talk, so the community members remember the message of the day. We've got a few presentations saved from previous years that can be reused if needed. In order to increase the central resource bank of talks and maintain a recognized brand and uniformity, we have created a PowerPoint template with a chosen color theme and design for this year's campaign. This can be found in the Google Drive. The first slide of the presentation is the campaign slide with the RHAC logo and the MSc logo. We would advise adding your centre's logo, and if you are part of an organisation delivering this campaign, add your logo next to the MSc logo on the first slide. If the topic of the talk has a health charity or organisation that will be referred to, we would suggest adding their logo or logos to the second slide. The penultimate slide should have a summary of the talk and the key take-home points, and the final slide should have contact details or a website of a health organisation or charity that the public can access if they want more information. You could also plan to have leaflets on a stall or ask someone to hand them out after the talk. With regards to the PowerPoint presentations, we would recommend setting a deadline at least 10 days before the speaker's talk to send you the PowerPoint. This will give you plenty of time in case they are delayed to remind them. Once you have the slides, email them in advance to your centre and ask them to check if it works. You could always use different mediums to deliver the talks, perhaps using an existing video or even a live demonstration, for example CPR. We will have feedback forms on the Google Drive for you to print out and ask attendees to fill out. In addition to feedback on the talk, this will have space for attendees to give you ideas of talks they would like to hear about in the future, and will help us centrally in determining the effectiveness of this campaign. At the very least, please take it upon yourselves to ask attendees for qualitative feedback, which you can share with us after the campaign. And don't forget to take photos. This helps us centrally in creating reports and better PR for the campaign. If it's possible, record the talk so they can be shared after the talk.
Health screening. The health screening provides a free health check for members of the community with the aim of raising awareness of common and prevalent health conditions such as diabetes, obesity and high blood pressure, and also identifying risk factors for serious health problems such as stroke and cardiovascular disease. The screening day consists of a short circuit made up of stalls which members of the community are taken through in order to have their blood pressure, BMI, risk factors for diabetes checked, as well as providing them with an opportunity to consult with a wide range of healthcare professionals, including a GP, dentist, pharmacist, optician, dietitian, physiotherapist, and mental health services. The health screening is an integral part of the Ramadan Health Awareness campaign, one which is highly valued by members of the community, and each year we receive great feedback on this. We would encourage you all to take part and organise a health screening day at your centre. The details on the health screening will follow in part B of this training video, but in summary, it is not difficult to organise, and all you need to do to hold a successful health screening is to be passionate and dedicated and to start planning early. You will firstly need to contact your centre to get permission for holding the screening and to arrange a date and time for this to be held during the holy month of Ramadan. The next step is to get together a team of volunteers, including healthcare professionals, and to ensure that you have all the necessary equipment and data collection tools ready. And lastly, you'll need to advertise the event to the centre and community members to ensure there is maximum attendance at the screening day. For those of you who are interested in holding a health screening at your centre, please take a look at part B of this training video, where we will step by step take you through the entire process of how to organise a successful health screening.